going to show you how to don an ACE dorsiflexion wrap. All right, so we know with our patients that have spasticity, they oftentimes have an inverted foot. The goal of an ACE dorsiflexion wrap is to provide them the dorsiflexion, as well as sometimes you can bias the person towards eversion. So I look at the patient's foot, and Melly here has no ankle activity, all right, so she's going to be passive in this. And I have to think, if I want to pull the foot into eversion, I have to think about how I'm wrapping. And the same principles of wrapping like you would for bandaging apply, where it's the roll side down. But I have to think, if I want to pull this way, I have to wrap this way. So I start and I just anchor at the ball of the foot. Then I think about it. So I stretch them a little bit, all right? And I want to pull her into eversion. I'm going to exaggerate how I would do this with the patient just so you can see it on film. So I pull here. I actually pull a lot of the elastic out of the ACE bandage. Then I go up to the ankle and wrap it around. I cross in front. Again, this is where I take the elastic out so I get a nice pull, and I go out. Now, Melly's foot is nice and small. If I had a patient that had a much bigger foot, I use my shin to support it in dorsiflexion while I'm wrapping, all right? Because up here, I may need two hands to get it. Remember, I want it up and everted. And I go around, and I use it there. Again, up, eversion. Okay, so now I have this extremely, if you put her foot down, you can see that not only, slide forward for me. Not only is she dorsiflexed, but she's everted a good bit. All right, this is an exaggeration for the purpose of the video. What I really want to do is show you how I'd have it done in the end. All right. Yeah, okay, so the purpose is dorsiflexion, and sometimes we have to give the eversion moment. So I need to wrap this way for this foot. Okay, just anchor at first. Remember, this foot is floppy, so it doesn't go. You're doing all the work. The patient's not helping you. These shoes are a little flimsy here. Can I tug the elastic out? Tugging it out, using my shin to keep it up. Okay. I don't have to use the whole band as long as I've accomplished what I've wanted. And so here we have a little bit of eversion, and we certainly have dorsiflexion. Now, some people, there's different ways to do an ACE dorsiflexion wrap. I have always kept it low because that's what works for me. There are other ways of coming up near the knee. So in clinic and when you're on rotation, you may see people wrap it up higher. They're not wrong. This is just the way that it's worked for me.